Now I call upon Dr. SANITHA SATHYAN for building rapport with a pediatric patient. She doesn't need any special introduction.
A very good morning to all of you. And I really thank Dr. Suchitra for having me here and trusting me with this topic. And I am to speak about building rapport with a pediatric patient. And I would like to say that building rapport with a child is not at all a child's play, because children pose a different kind of challenge. Some children you might feel they are very meek, but when you try to examine them, they'll be very uncooperative. And most important thing is that you needn't have your order of examinations that right. You can try whatever is comfortable for the child, whatever is comfortable for you, and then you can collate your observations. Some children you might feel that they are very okay kind, but sometimes it may be very difficult to elicit clinical responses. Whereas this girl, she is very, very cooperative. This is a 15 diopter prism based on test, which is very difficult to elicit, but look how she is cooperating to that more than an adult. And you can see all that coming ocular motility differences in this child. As Sir rightly told, there is a very important role for our non-verbal communication skills. And the child, as they come into the consultation room, they are judging us whether to be trusted. Prashna ano. And they are all very familiar with going to hospitals for all this respiratory problems and plenty of injections. So they are actually trying to judge us. So we have to win their confidence and follow their leads. And in this way, I think most of the children, they say that there is no child who is unexaminable on a slit lamp. It is possible to do, but we'll have to find out how. We'll have to learn that art. And most important thing is providing, as human beings, the first and foremost thing is what we seek is safety. So for the child, it's very important. The child should feel, we are all safe with all the accreditations, but child should feel that we are providing them with a safe environment, non-threatening, trusting environment. And stranger anxieties develops in children, and our social or environmental structures actually reinforce. Being a medical professional, sometimes we are the people, some parents, when they come in, they want the child to obey. So the first thing is അനുസരിച്ചില്ലെങ്കിൽ injection വെക്കും. That puts a very bad mark on us in the child's eyes. So, and take your time and show respect to the children. And children are, they deserve respect. And don't think that they don't have an individuality, they don't have a personality. They do it, they have it, I think, more than adults. And that is an important thing. And be genuine in your interactions. I think as a parent also, if you are faking something, your children will understand. If you are genuine, it will be good for us and for the relationship also. And sometimes we say that usually the OP sister says, "Idu cheyidu kazhinja chocolate vaangichu tharam." That is a false promise. Don't go, you won't be able to fulfill it. And next time when the child comes, child knows that no chocolate is going to be given here. So don't make such things, don't say things which you cannot do. And be very relaxed and friendly and interact to the child as a person, and be very truthful in your interactions. It's possible to elicit whatever you need even when you are genuine and truthful also. And I think the children will appreciate it more. So this is a Down syndrome child. In the background, you can hear that Kake Kake Kudavide song, but audio is not there. That's okay. So any child can be, so you need to have special examination tools also. Like this is a lens bar. So if you do a refraction in a child with this comorbidity using a spectacle frame, it's very difficult to introduce the spectacle frame, to put one lens, the other lens. This is a lens bar in which you can have different lenses in order, and it is too easy to examine. And be authentic, and building connections with children is very important. And 1 month back, I had a patient from Ireland. So in a I wanted to build a connection. So I just asked him, "What is your hobby? What do you do?" And some connections are very difficult. He told me that killing ants. killing ants. Urumbina kolla. It's very difficult, very curious kind of job, hobby, but it's difficult to connect, but okay. And the commonality we have to win, and then setting boundaries. I would like to talk that don't touch children unnecessarily. We don't want us to be touched. We feel that children don't go and grab them, because it's a setting of boundaries is also very important. Even without doing all those things, you can examine a child, and touch is very important. I do agree to that, but as professionals, you don't want your OP sister to hold the child on her. That kind of things are not professional. But and children with special needs, especially with autistic children and children with cerebral palsy, even the touch is very painful for them. So don't go and attempt if you want to examine such things in a very professional way. So this is an old video, how to examine any child. So initially this child thought that it is okay, you can undergo a slit lamp examination. But when somebody is forcing him, my OP sister actually tries to make the examination easier for me. He doesn't want to do that. And then a lot of convincing has to happen here. So I'm trying to show him all this in a bit to put his chin over there. One more minute, I think, here. So this toy he is very fond of. Most of the children were fond of this toy, and so, but he is not wavering to this temptation also. And mostly mothers and fathers, they would like to keep their children's chin over there, because they feel that they are wasting our time. Nothing like that. Be very patient to the child. And so the first phase, actually this is a one long unedited video. So I'm showing him, this is your chin. Okay. So I have asked his mother to let him off. Can you keep your chin here? Okay. Now he feels that I am more okay with him, and he wants that toy. Okay, let him have it. Can you keep your chin? So mother wants to bribe him for keeping the chin. So finally, he is very cooperative for my examination. And for the indirect examination also, one thing is that you have to be quick with your examinations. You cannot take a long time to find your, introduce the instrument, explain to him what the procedure is. And then you might have to use some restraint, but sometimes it's not necessary. I'm not touching him even while doing a indirect examination. It's possible to do that. So this is my last slide. Explain to the child what's happening. They appreciate that. And in case of spectacle choice also, ask the patient, patient has to wear, so he can make a choice of spectacles. If there are some issues with a child wearing a spectacle, try to talk with the child and get his problem, and not with the parent. Celebrate small victories. And one thing is, be careful with patronizing. If you ask one day I told a patient that, see, number of children in your school are wearing spectacles. He told me, don't compare me with others. So that was okay. I thought that's not right. And then we say that if you do squint surgery, some parents say that you will be more beautiful. Nothing like that. Don't say unnecessary things. And the world is changing also. Children don't want to be patronized, and I think we should learn from them in that. Thank you.
Thank you, Dr. Sanitha. Yeah, it's very important. Body shaming is very important aspect. So you can't talk about squint to the kids also.